The Health Professions Council of South Africa has joined those condemning the ongoing healthcare workers' strike. There have been disruptions at several facilities with patients and staff intimidated. Let's discuss this further now with Professor Simon Nemutandani. He's the president of the Health Professions Council of South Africa. That's the HPCSA. Prof, good afternoon. Thanks for joining us on today. Not a good state of affairs in terms of what's been happening, especially in the last couple of days, with members of Nehawu intimidating and threatening other staff members and other workers, including from a sister union, SATU, from what we understand, and SATU has come out as well condemning these actions. What is your stance?
Well, then, as HPCSA, we are very concerned about the impact of the ongoing strike that it has on the practitioners, patients, and the public. And from our side, we are appealing to the striking members to respect the rights of others. Those who do not want to get involved should not be forced. They should be allowed to provide the services to our patient. Well, of course, we understand that there will be a need to strike or those who want to exercise their right to withhold labor, but we strongly condemn those who are blocking the roads and preventing patients to access the health service. This is not acceptable at all, and we think we should condemn it at all costs. Yeah, that is the position of HPC.
Yeah, in your statement that you released yesterday, you say that it is your responsibility to ensure the protection and safety of members of the public and healthcare workers who are registered with the council. What kind of measures are you putting in place to bring this about?
Well, in terms of our roles, we are to make sure that the public is protected. Number one, anyone who wants to access health services countrywide, whether it's in the clinic or hospital or the health center, we have a responsibility to make sure that we have health providers in the facilities who should make sure that those patients and public access the services. So now, if there are striking members who are preventing others from doing that, we think it's unacceptable, and we are calling on all those who are involved, stakeholders, to make sure that the rights of the patient to access health services across all our facilities should be allowed to do that. At the same time, we are saying to our practitioners, if within themselves they find that they don't want to participate in a strike, they should be allowed to exercise their rights, and nobody should force them. If there are those that could report that they were forced not to join the strike, we will take actions against those members who are registered with us that have forced us others or stopped patients from accessing health services. We'll take severe steps against them because patients' rights should be respected. Also, at the same time, those that want to exercise their rights, they should do so, but understanding that we cannot, after the strike, go back to the graves or those that would have lost their lives and say, we are sorry. We must respect life at all costs.
You know, the challenging issue here when it comes to health service, for example, is that you are an essential service. While the right to strike is constitutionally guaranteed, we cannot lose sight that in the health profession, as an essential service, you really have to be mindful about how you carry out your actions.
Yeah, you're correct. But we expect that managers of different hospitals, be it the CEOs, they should make sure that service continues. I mean, in an emergency, patients should have the access to the practitioners. It is the responsibility of the managers of those facilities to make sure that we have health practitioners at all times in the facility. It will be unacceptable for a patient to go to a hospital, even if we have striking members, and those striking members are not providing the service. The managers should make sure that there are critical, essential services that are rendered at all times. That would not be accepted if hospitals and facilities have not made that arrangement. It will be the responsibility of all stakeholders to respect life, because this is where it's a matter of life and death. Imagine, and I'm encouraged by some of the reports that striking members have respected the ambulances that were going to the hospital, that we encourage. But we should not stop at that level. We should say nobody should be stopped from accessing the facilities that we have for our patients.
Thank you very much for your time this afternoon. Simon Nemutandani, the President of the Health Professions Council of South Africa.